Good morning. It's Sunday, October 17th, 2021, and Sarah and I are going to give the COVID update for Lake County. And we want to say thank you to Sam for helping us put this together on a Sunday morning. I'm Gary Pace, working as interim basis as a public health officer for Lake County, and I've transitioned to other jobs, but I'm part of a group that's helping to fill this role while a permanent solution is found. As an overview, we're continuing to see a gradual improvement in case rates and also a slow, gradual increase in vaccination coverage. So Sarah will go ahead and share the specific data. Sarah?
So I have a brief update. I'm going to report on the latest coverage in vaccines and then some state and local trends in terms of transmission. So as of yesterday, October 16th, 34,000 residents in Lake County are fully vaccinated. That's 62% of the eligible population. And just under 17,000 eligible people are unvaccinated. In the last 3 weeks, there's been some great progress in the increase in people who are fully vaccinated. About 1,000 people became fully vaccinated in the last 3 weeks, which is a great achievement. However, looking forward, I've seen in the data that over the same time period, the number of people getting their first dose has declined dramatically. So I expect that the rate, at least over the next month, of the number of people becoming fully vaccinated will decline and won't be as high as this 1,000 in the last 3 weeks. The majority of eligible people and the majority of people in Lake County are fully vaccinated. Unvaccinated people made up the vast majority of cases in Lake County from June through September. So here you can see by month, June, July, August, and September, that in June, about 94% of cases were unvaccinated. And then in the summer, July, August, and September, 86% of cases were unvaccinated. Again, the number of people who are unvaccinated is about 17,000. The number of fully vaccinated people is about 34,000. And so we see disproportionately the majority of cases in unvaccinated people in Lake County. And these were data that were requested by the board and others over the last couple months. And so I'm pleased to present them now, looking at hospitalizations and vaccination status. So in July and August, about 100 Lake County cases were hospitalized. This includes people who are hospitalized in Lake County, as well as people who were hospitalized outside of Lake County. And about 80% of them were unvaccinated, and about 13% were fully vaccinated. Give a brief overview of the latest trends in testing and cases in Lake County and the state. So on the left, we're looking at testing, the tests per 100,000 in Lake County, this black line here. The state is the gray line here. You can see that testing has come down. The testing rate has come down a little bit since the peak this summer with the surge of Delta. Similar trends statewide, but still remaining relatively high compared to the rest of the pandemic. It's nice to see that we've had a decline in testing positivity down to 5.3%, which has been a dramatic decline since, again, the peak of the surge earlier this summer. You can see the state has had a corresponding decline from about 7 or 8% down to about 2 to 3%. Here's the latest EpiCurve for Lake County. So these are Lake County confirmed PCR cases. So for the week of October 3rd to 9th, we've identified about 83 cases, down from the peak in early August of nearly 300 cases. So we continue to see a decline in the number of new cases identified in Lake County. I just wanted to speak for a moment about statewide and regional trends. So this blue line here, we're looking at the daily case rate per 100,000 in California. You can see the state was at all-time lows in June, and then we saw the dramatic increase statewide and in Lake County, driven largely by the Delta variant. And we've seen it decrease here in Lake County really since the beginning of September, for the last couple of weeks, down to below 20 per 100,000. Statewide, all the indicators that we look at statewide are positive, showing promising trends. That's the decline in testing positivity, maintaining high levels of testing, reduction in the number of people, COVID hospitalized patients, and an increase in the number of ICU beds that are available statewide. I'm showing the Northern California region, which is referred to as Rancho here in the orange line. So you can see their increase was a little bit later than Lake County's, but is starting to see a decrease. And if we were looking at this, if we were looking at some of Lake County's neighbors, we would see Napa is following a trend line roughly that of the state. Sonoma County has a slightly lower case rate, and Mendocino County has a similar trend line as Lake County here in the green. So here we're, as of Thursday, the Lake County hospitals reported 8 COVID hospitalized patients. You can see the decline in the 14-day average number of COVID hospitalized patients in Lake County. And then the 2 hospitals reported 3 COVID ICU patients on Thursday. Again, the 14-day average is down. We'll note that these data do not include Lake County residents who are hospitalized out of county. While this is an improvement, we've still seen over the last couple of days, the hospitals reporting 0 or 1 available ICU beds. This is due to people being in the ICU for reasons other than COVID. And lastly, unfortunately, the state in California, we passed 70,000 COVID deaths just a couple of days ago. And in Lake County, passed over 100 COVID deaths, now reporting 104 COVID deaths among Lake County residents. Saw a significant number of deaths through July, August, and September. And that's all that I have for today. Thank you.
Thank you, Sarah. So I want to emphasize a few points here that one, that we are over 60% vaccinated in the county. That's 34,000 people are fully vaccinated. So those folks are relatively protected against severe illness, hospitalization, and death. Not completely, but the vast majority of people were the unvaccinated folks, the 17,000 that still are yet to be vaccinated. So this makes me hopeful that we may be able to avoid the worst outcomes of that could be coming if we do have a fall winter surge. Looking at the pattern so far, there's been a surge every few months. And so with the winter coming and people being indoors, et cetera, we can probably expect that we will have a surge in the November, December, January kind of time frame. No guarantees, but hopefully with this level of vaccination, we're going to at least see some protection from the most severe outcomes from that. So as Sarah was showing in there, the northern counties had a pretty high case rate and hospitalization rate over the last few months, starting to improve now. But the National Guard actually had to get called in to help some of the hospitals in Shasta County just a few weeks ago. And we think all this is due to the lower vaccination rates from the rest of the state. Some of the counties up north only have a 30 to 40% vaccination rate. So even though many people challenge the importance of vaccination, I think it's really clear, and I don't think there's any real controversy over this, that there are fewer problems in terms of hospitalizations and deaths in the areas with the higher vaccination rate. So the higher we can get that rate up in the area, the less we are at risk of severe outcomes from COVID. So that way we'd be able to keep the schools open and the hospitals from getting overwhelmed during the next surge. So today, what I really want to discuss is how we can work together moving forward. There's, we're in a time of a lot of polarization around politics and around a lot of these COVID sort of issues that it seems like a lot of our leadership is actually trying to divide us. And what I want to do today is try to make some bridging between the folks that are vaccinated and the folks that are unvaccinated. So, and public health is the kind of on the broad level, statewide, nationally, has really put a lot of focus in trying to convince unvaccinated people to kind of do the right thing and get the shot. And I want to shift this discussion a little bit today and look at what we know about the people that aren't getting vaccinated, and so that we can have more understanding and maybe less polarization, less treating them like the other and like they're not making good decisions, so that we can work together to prepare as a community really for the next surge. So as Sarah's pointed out in the past, in Lake County, the highest number of unvaccinated people tend to be white, non-Hispanic, and also the adolescent group. So now adolescents tend to not get as sick, but they can lead to spread in the community. And definitely when there are positive cases in the schools have to start shutting classes down and doing a lot of contact tracing. And so it really interferes with the learning experience. And if everybody remembers, a year ago, we tended to have most of the schools were not even open. And now it's very challenging for the schools and the leadership there to keep them functioning. And the fewer cases we have in the schools, the better it's going to be, and vaccination helps that. So there was a big article that came out in the New York Times recently that talked a lot about unvaccinated folks and this is all national level, but I think it really helps us think about it in Lake County. In the U.S., almost 95% of those people over 65 are vaccinated. So, and this is a little bit surprising because of some of the stereotypes of who's unvaccinated, because often the older folks, older Americans tend to be Republican. A lot of them watch Fox News. A lot of them receive a lot of the disinformation, yet they're still going ahead and getting vaccinated because their perception of risk versus benefit is in their favor. So, and this is really important, to get those older folks vaccinated is one of the ways to prevent deaths and prevent overwhelming of the hospitals. And if you look at the nursing homes, a year ago now, we were continually dealing with outbreaks in the nursing homes, and it was pretty overwhelming. And now there's very little cases in the nursing homes. We do have one small outbreak now in one of them, but it seems to be contained at this point. And it's and this is all because of the vaccination. So because pretty much everybody in the nursing home, all the residents are vaccinated at this point. The research shows that there are two groups of unvaccinated people in the country. One is vaccine resistant, and so these are the people that have very deep-seated views, and it's really important to their identity and their group that they're hanging out with to not get vaccinated. And then there's the vaccine hesitant, and these are the people that have concerns, but they're willing to consider vaccination, and they're just trying to sort of sort through everything. And it seems like the numbers are maybe 50-50 in terms of the unvaccinated people, whether they're in this very deeply held belief system versus just trying to sort out how to go through it safely. Employer vaccine mandates seem to be increasing the percentage of people getting vaccinated. So this is we weren't really sure how this was going to work out. And so, but even though many people said they were going to quit their jobs if they were going to be forced to get vaccinated, the vast majority ended up going ahead and getting the shots when mandated. So these are folks that we would kind of call vaccine hesitant. Once they were kind of pushed, they were willing to go ahead and get the shots, and it seems to be improving the numbers in certain communities. So some of the concerns that people are expressing that are leading them to be hesitant about getting vaccinated, I'm going to kind of walk through those a little bit, but you can see that a lot of these are pretty pretty darn reasonable, and maybe we can try to address them and make people more comfortable with moving ahead and getting the shots. I think part of this is it's less kind of lecturing to people and more about trying to set up the situation so that they can end up feeling more comfortable with going ahead and making the decision. So one of the big characteristics that they found is people that are not vaccinated tend to not be trusting of institutions and authorities. So under 40% of the unvaccinated said they trusted hospitals and doctors a lot. And whereas the people that were vaccinated, it was over 80% of those folks said that they trusted doctors and hospitals a lot. So these unvaccinated folks don't trust the information they're getting from the public health world. So me kind of going on and on about data and figures probably isn't going to help people change their mind a lot in that situation. The research has really showed that the unvaccinated people are really the kind of primary thing is that they're unsure that it's safe. That's what's leading to them being hesitant. They're not really necessarily concerned about broader conspiracy theories, but it's really a safety issue and what's going to happen to their health and the health of their family. And an interesting data point was that only 12% of the people that were unvaccinated said they didn't think they would benefit from the vaccine. So that means almost 90% of these folks that haven't gotten vaccinated really feel that they would benefit from the vaccine, but they're really more concerned about the risks. And young pregnant women are an area of real concern right now in the public health community because it's clear that COVID infection makes them much more at risk of bad outcomes. And there's a lot of stories now of women during late pregnancy or at delivery that end up dying from COVID-related causes, and now their baby doesn't have a mother because of just some of the complications of pregnancy with COVID. So yet only a third of young pregnant women are currently vaccinated. And so there's a big push now to try to get these women vaccinated as quickly as possible. But for sure, they're worried about the risk to the baby, and kind of the unknowns of the vaccine make them delay getting the vaccination. But then with the risk being so much greater, the outcome can be, disastrous. So this again just kind of points to the concerns about risk versus benefit. Fear of needles in about 20% of adults seems to be contributing to not wanting to get vaccinated in some people. And so in other countries, they're actually finding ways to accommodate people with fears of needle sticks. So more private rooms, more kind of just helping them feel more comfortable with the needle stick. But again, most of it seems to be around concerns about the long-term impacts of the vaccine. And so we're pretty sure that most of the bad effects, any of the bad outcomes are happening pretty quickly after the vaccine. So vaccination injuries don't seem to be long-term in terms of you don't see them for many months down the road. The vast majority, this is true for all vaccines, that seems to happen soon afterwards. And if you get through the first several weeks or so without any problems, you're probably going to be okay. So this is something, but because of concerns about long-term side effects from medications, I think people are sort of mixing it up a little bit. And even though they are looking around and seeing that the vast majority of people are doing fine 6 months down the road, they're still worried about some possible long-term effects. And that's probably not going to happen. So, basically what we can see is there's a complex mix of reasons that people haven't gotten vaccinated. I guess the thing I'm trying to sort of emphasize here is that a lot of these are fairly reasonable, and these people are kind of looking out for their own health and the health of their family. And so even though in the public health community, we think the risk of the vaccine is much lower than the risk of COVID, and that if we can really kind of stop this from spreading through vaccination, people are going to be a lot better off. I think a lot of people are making choices for themselves and their family that are at least reasonable from the way they're looking at it. So I want to really try to decrease the divisiveness here, and that sort of picture that gets painted sometimes of all unvaccinated people. They're kind of selfish, and they're kind of taking these disinformation information on the internet to extremes. I think people are really choosing based on the information they have at hand and that they trust. And I think we should try to all work together on this moving forward and really talk about the community health so that even if people do need to continue to avoid vaccination for whatever reason, that they can adopt some of the other safety measures to keep the rest of the people safe. So I do want to just review how to get a shot. So vaccine is readily available at most of the pharmacies. Many of the healthcare providers still give vaccine. We do still have the vaccine ban, at least for a couple more weeks. So that's available, and you can go online and find out about that. And if somebody in your family is homebound and can't get out, you can contact the health department, and we can get to a lot of places to help people get their shots. There's also some community outreach. The Heroes of Health and Safety was yesterday at the fairgrounds, and COVID and flu vaccine was available there. And there's some other community outreach programs that are ongoing over the upcoming weeks. Third doses are available for people who got Pfizer and their second dose was at least 6 months ago. Moderna and J&J are in the pipeline to get approved in the near future, and I expect that to happen probably before Thanksgiving. The schools are dealing with cases a lot now, and like I said before, it's really disruptive to have the school cases showing up in the schools, and so really encouraging school-age kids to get the shots. And we anticipate the children 5 and older will be approved for vaccination probably within the next couple of weeks. So kind of overall and in conclusion, I just want to say that we all have to work together here. Being real polarized and kind of on opposite sides of the argument really isn't helping anybody, I don't think. And I think, preventative measures like a healthy lifestyle and a good diet are great ideas. They're always a good idea, and certainly in this situation, but I don't think that's enough. There are some treatments for people when they do get sick, and monoclonal antibodies and remdesivir are available now, and there's a new medication a pill that they're talking about trying to get available here in the near future that helps people that are already infected, prevent severe outcomes. So we'll see if that's working its way through the approval process. But, really our best hope is to continue our public health efforts, the vaccines, which we've been talking a lot about today, and the testing and quarantine when you're close contact and work overnight. Taking action has a higher risk, but if you or your family is choosing not to get vaccinated, then please be considerate of the rest of your family and your neighbors, and wear your mask when you're indoors, stay home if you're sick, and really talk to your medical provider if you have concerns that are preventing you from getting the vaccine, and that you have questions or concerns that maybe we can help you with. And again, thank you for all the work. We're really excited that there's over 60% of people vaccinated in the county, and we're hoping that that's going to prevent the really bad outcomes here if and when we do have another surge, and keep kind of wearing masks and working with us on this, and hopefully we'll get through the winter in an okay state. So thank you very much.